This is the incorrect way to hold a needle driver. This is the correct way to hold a needle driver. This is a technique called palming, with the meat of my thumb, my thenar muscle, pressing on one part of it, and then the inside of the other part of my hand pressing on the other. And what it allows me to do is I can lock and unlock very easily, and I have very fine control over opening and closing and controlling this, and can move it around in my hand very quickly without having my fingers ever go into these holes right here where they can be trapped. If you're just throwing a few sutures every once in a while, then it really doesn't matter and you can use your fingers in here. But if you're working in the operating room and you're throwing a lot of sutures, it can be very advantageous to not have your fingers trapped in these holes right here. One example is if you're throwing a stitch like so and you're pulling it through, then right as you take it out of the skin, although I've clamped it in exactly the right spot that I want to throw the next stitch, my hand is not in the position to throw the stitch. And so if I'm palming it, I just go like this, and then I proceed to throw the next stitch, like so. I'm immediately in the next position. Whereas when I take it out like this, if my fingers are in these holes right here, then although I've grabbed it in the right spot, if I want to throw my next stitch, I then have to take my fingers out of those holes, turn this over again in my hand, and then put my fingers back in those holes to start throwing the next stitch. And that's just a lot of extra time that, if repeated over and over and over in the OR, is going to make any task I'm doing in suturing take much longer. So that's why when you're learning how to use a needle driver and how to stitch, you should get used to having it in your hand like this, learning how to open and close with just your palms, flip it around, and just get used to using the needle driver like so. That way you can have ultimate fine control over where you're grabbing and how you're moving it in the OR.